Welcome back to One Place PT. In today's video, we're discussing a specialized treatment called dry needling. If you haven't heard of it, it is a specialized technique that increases blood flow and decreases nerve sensitivity, ultimately decreasing pain. A very thin needle is inserted into both the muscle and the connective tissues to target multiple layers. These layers can't otherwise be reached through traditional therapy methods. By accessing these deeper layers, we can encourage blood flow and ease muscle tension, aiding in a faster and more effective recovery process. Today, one of our clinicians, Chris Golt, will be demonstrating this dry needling technique. Chris will be working with a patient who has neck and shoulder symptoms. He's tried traditional approaches like stretching that hasn't really worked. His job as a professional dancer requires him to use his shoulder and arms every single day. So it's essential to get him back for his performance and quality of life. Now let's get a close-up look at the treatment itself.
So when I put the needles in, you might feel a little bit of a prick, but everything else should maybe, I'm looking for like some of that dull aching sensation. When you start getting that, let me know. Don't let it get too intense though, okay? Feel tightness there? Good, good, perfect. I'll do a little bit of winding, which should increase that tightness. That's going to actually allow some of those tissues in your muscles to kind of be wound up, and that has a mechanical stress on there. That mechanical stress actually leads to some more chemical response for healing. We're going to come up over here now. Get to the upper parts of that neck where that muscle attaches at. Doing a little bit lower on this side too. Going to the right side here, same thing. Let me know if you feel a little achiness. Right there? Yeah. All right. And one more over here. How is that? Not bad? Okay, perfect. Now we'll hook up some electricity to it, okay? That's going to create a little bit more blood flow in there. And we all know that nervous system, the body needs blood to survive. If we bring some good blood to that area, that nervous system is a little less sensitive, meaning it doesn't send as much pain to the brain. We're going to start over here on this left shoulder. Let me know if you feel tapping right over here, okay? Sure. A little bit there. Okay, we're going to come up to the neck here on this left side. Knowing if you feel tapping over here. Yep. Okay, now we'll go to the right upper trap area, okay? Now throughout the time, it's got about 15 minutes we'll leave it on for. Probably within the first 3 to 4 minutes, you may or may not notice that it feels like it's getting more intense or less intense. Let me know. That way I can adjust it so it's just a light tapping is all I want you to feel, okay?
Thanks for watching. If you're interested in learning more about dry needling, click on the link in the description, and don't forget to subscribe for more recovery tips. See you next time.